Urinary tract infections is one of the commoner infections that happen in infancy and childhood. It's responsible for many of the visits to primary care physicians' offices, especially in children with fevers. Urinary tract infections in children are caused by entry of bacteria into the bladder. In infants, it's common in boys. However, beyond the first year of life, it's less common in boys, especially those that are circumcised. Beyond the first year of life, it's much commoner in girls. Urethra, or the tube that takes the urine out of the bladder, from the bladder to the outside, is much shorter in girls than in boys. And so bacteria come in from, most of the bacteria that cause infections reside in the rectum. And so they come out, colonize the perineum, colonize the vagina, colonize the urethra, invade the bladder. Whenever you take your child to the family doctor or to the pediatrician and the baby has a fever, it's always good to collect a urine specimen, but make sure that the urine is tested for the presence of white blood cells or pus cells, because that's a sign of inflammation or infection. If I have white blood cells in the urine, then the body's trying to fight an infection. If I just collect the urine and culture it and there's just bacteria with no pus cells, that's not a sign of infection.